Guys, it's Anthony Carey with Function First. Today I'm going to share with you an exercise that can be both a test and an exercise, but we give it to a lot of our clients because it's a really great way to sort of passively relax the hip flexors. Now, the hip flexors are one of those muscle groups that have such a major influence on the lower back, the sacroiliac area, and even the hip joint. So what we're going to do is show you a way that you can kind of passively relax into it. Now, we know that this isn't the end game, but it is often a way, especially when we're experiencing pain, to relax this muscle group that can have a profound impact into our lower back. So what I'm going to show you first is that I'm going to have to use a really firm, sturdy table. Now people often use the island in their kitchen. You don't want to use anything that's too flimsy because you're going to put your whole body weight on it. Now what I'm going to do based on my height is I'm going to squat down a little bit, because what I want to do is I want to do the best I can to get the axis of my hip joint here on the side right along the edge of the table. And what I'm going to do is I'm squatting down a little bit, and then I'm going to take both my legs back, especially for folks that are experiencing lower back pain. This is a safer way to get into it. So I'm going to bring both my knees to my chest as I lay back. So as I'm laying back onto the table, I want to relax my head. Here I get to also feel that my lower back is nice and flat because I want to maintain that positioning. I'm going to grab hold of one knee, either on top or one hand under the bottom, and then I'm going to let the other leg just relax down and passively drop. Now, as that tension increases on the hip flexor, my pelvis is going to want to tip forward. So now I have to use the abs a little bit more to pull that lower back flat down. I'm going to keep the abs nice and tight, and this leg should be completely relaxed. Gravity's doing all the work and pulling it down. Now, you might be able to see that my leg is hanging down at a decent distance, but with some folks, what will happen is that leg will stay way up there, and that's because the hips are really tight in that just the weight of the leg and gravity is not allowing them to pass down. Now, one of the other things I'm going to show you right now is a way that we can introduce a little bit of extra correction that some of you might experience, where your leg starts to flare out to the side, meaning that it's no longer in line with the hip joint. It's going to want to go out to the side. So in this case, I'm going to use the left leg, and with the left leg, I'm going to use the chair that is going to come along with the table, and that's going to serve as a little barrier. So instead of letting my leg fall out, this time, again, sitting back the same, using the abs, I'm going to bring the right knee to the chest, let the left leg hang, but now I've got the barrier here of the chair that is going to keep it from flaring out to the side. Now, for some folks, getting on the table may not be possible, or you may feel a little bit vulnerable, where your leg is hanging out that way. You're not feeling as stable through your lower back the way that you would hope to and eventually will. So one alternative is to actually use something like a bench. Now, even though I won't get the same degree of stretch, having my heel on the ground will allow me a little bit more sense of security, because I'll feel like I'm in contact with the floor. I have a little bit more control over my surroundings. So same thing, I'm going to be a little bit closer to the edge. Now, you got to be careful your bench doesn't fly up on you. So I'm going to keep my weight centered here, lay back, and then scoot up a little bit. Again, I can bring both legs up, but if I'm going to bring this right leg down, you'll see that I have enough mobility in my hip that I can rest on the ground. Now, I'm still getting some opening and stretch here, not as much if it was free hanging, but what I do get to experience is the sense of security and a little bit of stability from the ground there. So it's a nice trade-off some of you might want to try. So give this a go. It's a nice early exercise in the intervention. You don't necessarily want to do this at the end of your program. It's done a little bit more, you'll see frequently, in the beginning to the middle, because then we want to add some stability afterwards. Tell us what you think.